Hi, I'm Ed Jacobs, founder of Impact Therapy. And I'm here. Impact Therapy is a creative, multisensory, theory-driven approach to counseling. And what we're going to show today is I'm with Heidi O'Toole, and we're going to show the use of impact therapy with motivational interviewing. Heidi does a number of workshops throughout the country on motivational interviewing with addictions and with the use of impact therapy.
It's a great combination, the impact therapy, adding that to the style of motivational interviewing. And motivational interviewing is a style, again, it was developed after the stages of change model to focus specifically when people were stuck in pre-contemplation and then contemplation. The two main concepts of motivational interviewing is exploring the ambivalence and then also rolling with the resistance.
So why don't you show 2 or 3 of the techniques when you're teaching motivational interviewing and how impact therapy fits into
Fits
it.
right into it. Okay. So
What do you want me?
I would like you to play a very resistant client.
Okay.
Okay.
I don't think any of this makes any sense. I mean, so I drink a lot. I think a lot of people are all over me. My wife, I think just because she doesn't drink, and she used to drink, she doesn't drink now. And she's on that, and my boss, I believe.
So like the world's beating up on you or targeting you.
Yeah, and so I'm here. I don't know what
you have
can do.
To be.
Right, exactly.
And really, I'm here to help you. I realize that's your perception, that everybody's coming down on you, and you really don't want to quit drinking.
Right.
If they would just get off your back, life would be better?
Yeah.
Okay. So I'm here to be helpful to you to support your process, and it's really to support a change process. Now, we don't know what that looks like right now, but we do know that change is a process, and we're just going to start right where you are. Where you are right now is resistant to that change process. I'd like you just to do something with me if you're willing. If you would just hold your hand up to mine. Are you willing to do that? Just hold your hand up there to mine. Okay. Resist. There you see. There. See a little bit of resistance. See, you're feeling like people are pressuring you, right? And they're pushing you.
Well, and I want to win.
And you want to win. So with a little bit of resistance, I see how you reacted. You resisted back. So here's what I'd like you to do. I'd like you just to give me all you've got. Go ahead. Just give it to me. Give it to me. Give it to me. Okay, just stop right here. Now what's happened? You're all resisted out, aren't you? I didn't resist back, did I?
No.
I'm not here to push you. I'm not here to resist you. I'm here to help you explore what the problems are.
Now, you would do that in a session?
Absolutely.
And why do you think that's impact therapy? I mean,
well, we're using the body, so we're using motor sensory techniques in order as I'm talking. And so that's making this concept of resistance concrete to the client. Many of our many of our clients, especially in addictions, they're very defensive, and they need to be in order to survive that world. And what this shows them is, I'm going to do what I say, number one, and when they're all resisted out, I'm not going to take advantage of their vulnerability.
What are some other techniques that you do that tie into motivational interviewing?
Well, again, going back to the stages of change is a process, and then the multi-sensory piece to impact therapy, the use of chairs, movement. Again, it's motor sensory. It makes the concept of change very concrete. So I'll show movement and how it just happens in stages.
Like, what do you mean?
So we'll do, so again, just play somebody that's resistant or ambivalent to this process of recovery.
I just don't know. I don't know if I'm ready to quit. Yeah, I just don't know.
And I just want to let you know that is very common. Okay, so that makes sense to me. Why you don't know? It's almost like if I would have 2 chairs, I'd add a chair to where you're currently sitting, and so this is come to see Heidi, come to treatment, get counseling, maybe go to some meetings, seat. And then this is, go ahead, get up and sit in this seat. This is the seat of where I want to keep drinking or drugging. So, now talk to me about what it is that you miss there. What is it that you
Well, I'm going to miss the tailgate parties.
Okay.
And
football season's coming up. Yeah.
Sure.
It's hard to imagine not doing football without
Right.
alcohol, right?
Right.
Okay, now come back here. And then this is the see, but if I don't get sober, you're in jeopardy of your wife leaving.
Oh
and
yeah,
losing your
she
kid.
said she will leave.
This is it, right?
Yeah, she's not willing to go to the.
No, she's
Yeah.
not going to participate in this anymore at all.
Right.
Okay. And if that happens, then you won't. You have your.
Well, I lose my kids too.
Right. Exactly.
She says, "No, I'm not going to have you be around the kids if you're going to keep drinking."
Right. Okay. So go back to this seat. Go back to the drinking seat. And I think you said something about, but boy, if I just could drink a couple, if I just drank a few.
Yeah.
Okay, and that wouldn't that be okay?
But I tried that, and that doesn't
and see
work.
so come back here. See, that does. See, this is really just it's the definition of ambivalence, Ed. Okay, it's when you're simultaneously attracted to and repulsed by a certain object. And see that
What is the goal then?
the goal is
To get
the
me
goal,
to this seat?
The goal is to keep you here and to get this behind you. We've got to. I'm willing to work with you till we can get that alcoholic lifestyle, the drinking behind you.
The chairs seem to help because it gives me a choice, right? Is that why?
Well, it gives you a choice, and it gets you to hear yourself talk about where you are. This is what goes on in the client's mind. We often talk about a tennis match or a ping pong match, and this is their self-talk.
And why do you tie this to motivational interview? Or why do you teach it when you're teaching?
In motivational interviewing, you use this style when there's resistance and ambivalence. And so it's really when someone goes back and forth, vacillates from pre-contemplation to contemplation. So we try to show it for cause and effect. And so if you keep drinking when you're sitting in this chair, you will lose your kids, your relationship, your wife. If you stay sober, then you have a shot at having a family and having a better life.
Well, I know that impact therapy is a very active approach. Motivational interviewing is probably less active in a sense.
It is.
But what you're saying is you can show how making motivational interviewing.
Well, it's to make it more engaging. Okay, it is a passive style. It's a style of counseling. That's how it is. They developed it. And so what I've done in my workshops is taken their style and all of the tenets, and I've just added.
Okay.
I've added the multisensory because again, it's an adjunct. It's a supplement.
So if you're doing motivational interviewing, you can still use impact therapy ideas.
You can be multisensory even if you're using the motivational interviewing style. Yes.
Yeah. For more information about impact therapy, go to the website impacttherapy.com.